Somebody who really wants to get to know their patients, to make a difference in their lives.
A willingness to, work with all kinds of people.
An open-mindedness.
Be creative, think outside of the box.
I think you need to be able to talk to patients, to listen.
Allows you to be a little more independent and a little more involved in detail and depth of the care.
Hit the ground running.
A desire to help.
There's an appreciation and a relationship that exists here that doesn't exist other places.
People will welcome you with open arms if you want to practice in a rural area.
I saw this beautiful town sort of nestled in the hills of the Appalachian Mountains. The intimate relationship that the doctors have with their patients here in rural America as opposed to sort of urban America, it's different. Out here you know exactly which house the patient's from and what street. You know their family. The city's so big, there's so much anonymity that I don't think that the doctors have that same relationship with all their patients like I've seen here.
I have more time with the patients. I have the ability to get to know them on a more personal level. It's not just treating them, but caring for them and all of their needs.
It seems to me, and it seems to be a consensus among other dentists, that there's a greater appreciation for the practitioner. Having someone not from this area come to work here, I think they also appreciate the diversity.
Being a professional, my husband's a professional, we've met a group of professional people here in Allegheny and Garrett counties, and they want the same things. They want the upward mobility, they want all of those things, and I think as a spouse supporting your husband or as professional in the household, I think that I know that it can work with the community connections that you make, and it's here.
I would argue that in our location and in a small community like ours, you can become more of a professional than you might become in other places. In other hospitals and other medical situations, physicians are restricted. They're restricted by the number of specialists that exist in the community. They're restricted by the competition that exists. They're really restricted by the large sense of medical professions that surround them. Here, there is less of that critical mass, so that A, the patients that come to our facility rely more on the physicians that are here, and B, it allows the physician, out of necessity to some degree, to grow beyond some limitation artificially set by some committee or some organization. It allows them to be the kind of professional, the kind of physician that they've trained to be.
Small communities are kind of easy to become very involved in it. You can, I think, easier make attachments to your patients. You're part of the same much smaller community, so it's easier to become kind of a one-on-one involved with them. So I think if you like that kind of closeness, continuity.
You know your patients, they know you, they recognize you as a human being and as a person. I bump into them in the grocery store and in church and in the mall, and they see you as one of them. And when I talk to them about opportunities to improve their lifestyle and improve their health, they see me really as a partner, as somebody who lives and works where they live and work, and it's really just been a wonderful relationship.
Western Maryland AHEC has a mission to improve access to and promote quality in healthcare through educational and other partnerships. So we accomplish that in a number of ways. Anything from getting high school students interested in becoming health professionals to training clinical education students from medical, pharmacy, dentistry, and other health profession schools to continuing education for health professionals, and even a medical residency rotation. And some other programs in partnerships, always in partnerships.
I think back about my own experiences in larger urban settings. I worked in South Florida for a while, and I worked in Pennsylvania, and primarily in urban areas. And it's a very, very different environment, and you're kind of doing your own thing. Here, we're reliant upon each other, and so it's a great feeling knowing that you can reach out to your neighbor across the street and say, hey, can you help me, kind of thing, or can you support what I want to do? Can you help to promote something that we want to do?
This is a community that works together. We are not a rich community, but the benefit to that is it forces agencies to work together, which you do not get in a city area, because I've worked in the health department in a city during my training. It's just part of my education system. So it's a community that tries to improve itself and keep going.
You can actually see your accomplishments in the community, and you can see things change for the better because you've actually worked here and you've worked on an issue. So I think that's a real benefit of working in a rural area.
Really, people taking care of each other and supporting each other. It's a great environment in terms of just the openness and people's willingness to share and support each other.
The great thing about this hospital is they see potential in individuals, and they put resources into them, and they encourage them to build those. I had a great mentor. She wanted to teach me everything she knew. She wanted to retire at a point. She didn't want that knowledge to be lost. The mentorship that happens in this community is what is so great about this community.
Recruitment, bringing newer, younger providers in is always essential because there's always an ebb and flow, and patients come and go, providers come and go. And in any community, and ours in particular, where we have a number of providers that we know that somewhere in the next 10 years are probably not going to continue to practice medicine. So we have to have some new providers that are going to take that on that role.
That gives a great opportunity for not only mid-level providers, but also new medical students to come out here and join practices where these physicians have established their patients, their networks within the community.
Most of the practices up here will be recruiting. If they're not recruiting now, they'll be recruiting fairly soon.
There is a brand new hospital in the area. It has wonderful facilities within it. The facilities available here, I think, are one of the things that always surprise people.
But what really struck me is the commitment that the board and this community made to progressive health care in Western Maryland is illustrated by this facility. We're not going anywhere, okay? They put a lot of resources, a lot of effort, a lot of energy into this new facility, the new hospital. So to me, that underscored the commitment that they take this seriously.
You just walk outside and it's just, you're surrounded with natural beauty all the time. I get out of my car at night and look up at the sky and see the stars just shining as bright as can be.
Just being able to get out into those trails, hiking and biking and getting on the water.
We've been tubing, we've been hiking, we go hiking all the time, we've been fishing, and it's all an adventure.
But there's a certain sense of peace about living in an area like this.
We could not accomplish our mission without our partners. They are exceptional. Actually, they're incredible. And the breadth of the partnership is deep. We've been in this community for over 35 years. So we've been developing, nurturing partnerships all that time. We're a neutral entity, and we don't deliver direct healthcare services, so all our partners do. We need their expertise, their input. We are all about trying to give them what they need, and they deserve it. They're exceptional.
For decades, AHEC has been instrumental in exposing rural practice opportunities to physicians and physician extenders and medical professionals in various disciplines. That has been critical to making them understand what life is like in the country.
Never been in an environment where we've had such a strong partnership. Our ability to work with folks at various levels in their education and their training together with the goal of improving the health of our community. AHEC's been a great partner for the health system and certainly been great for me.
AHECs have just been a big participator not only in education of the current staff in the community, but in trying to encourage students to train in the areas that we need in the future and come back.
I attended the Rural Health Workshop in 2011, set up by the Western Maryland AHEC. I came for a weekend and was able to explore both Garrett County and Allegheny County for their health field opportunities.
So you come out here for a period of time to experience, this sort of lifestyle, as opposed to the big city where most medical training facilities are. They put us up in very nice facilities. I've got internet access. They've been very accommodating in all aspects, especially with housing.
What we're trying to do is grow our own health professionals, and we're trying to bring people from the outside in to let them see what this area is like. What's the quality of life here and the quality of practice.
Everybody wants to live in a place that is supportive both personally and professionally, a place where you can have a quality of life. That is this place.
I would encourage someone who's never been to a rural area and lived there and worked there for any length of time to give it a try.
You want to get the most experience in the littlest amount of time and reach your full potential, then I would say the rural setting is the best place to be.
Someone who is looking for a good quality of life, looking for ability to make a huge impact.
And so if you want to establish that practice where you have this continuity of care with patients in the long term, there's no better place to do it.